Okay, I want to show you a chiropractic adjustment. Okay, so I have Tara here already lying face down on my chiropractic table, and we have already done an initial consultation and evaluation, and so I know what her condition is and what we are treating. Okay, so I want to show you with Tara, we adjust Tara's mid-back, low back, and her neck. Okay, so when patients come into my office, we will start the adjustment face down, and we will start with the mid-back or the thoracic spine. Okay, and then we'll go to the low back, and then we'll finish up with the neck on Tara today. Okay, so first things first, when the patient is face down on the table, we go in and we palpate muscle tissue. Okay, so I start at the low back just to see what the foundation of the spine is feeling like. Okay, feeling into these low back muscle tissues, pressing on what's called the SI joints, the sacroiliac joints, side to side. Okay, again, this is a region of the pelvis, seeing how they're moving, and feeling for those restrictions, or as I had mentioned previously, subluxations, misalignments. Okay, so going through, and then we work our way up. We feel through the tissue of the mid-back in between the shoulder blades, okay, all the way up to the shoulders. And when we find those restrictions, right, or subluxations, aka misalignments of the spine, what we do is we contact that bone. Okay, I'll tell the patient, in this case Tara, to take a deep breath in, all the way out. I follow her down, and then I do a little push at the bottom. Okay, and Tara felt we got those bones to move, we got mobility in the spine. Okay, I heard a couple pops, a couple cracks, right, aka cavitations, as we call them as chiropractors. So we know that we got mobility in Tara's spine there. Okay, we're gonna check just a couple other spots right here. So we'll have Tara take a deep breath in, all the way out, and lift your head just a little bit. There we go. Okay, go ahead and rest it. And then we'll do one more at the tip top. Okay, so go ahead and take a deep breath in. Last one, all the way out. Okay, I shift my body weight over here, ride it down, little push. There we go. Awesome. So now I know that we've got mobility in Tara's mid-back. All right. Next up, what we want to do is the low back. Okay, there's a couple methods that chiropractors may use for the low back. I'm going to demonstrate first the side posture adjustment. Okay, so what I'll have Tara do, go ahead, lay on your right hip and your right shoulder. I'm going to lift this headpiece up for her, okay, so that she can lay down on it like a pillow. And now with the side posture, I'm going to have her go bottom leg straight, top knee bent. I'm going to crisscross her arms, so we're going to get her in almost like this little pretzel-like position. Okay, so this is called side posture because Tara is technically lying on her side. Okay, and what this adjustment does is by pinning the knee down, okay, I'm going to put my knee on her knee. I know that she needs this side of her low back to move. Okay, I'm going to contact that bone right there. I'm going to rotate Tara, and then a little pull right there. Okay, so we got that bone to move. Awesome. Now we're going to do the other side as well, right? Because I know that the other side of her pelvis needs to move as well. Okay, so yes, Tara already knows that we are going to get in that other position. The bottom leg will go straight. Okay, the top knee will stay bent. I'm going to crisscross her arms and hold her chest back on the table, right? I know you guys may not be able to see all of this, and that's totally okay, but you know that we're going to get the other side of her low back as well. So we'll crisscross, we'll straighten that bottom leg. There we go, perfect, yep. And then I'll put that knee right on there. We're going to roll Tara over, and then just a little pull with the knee to induce that motion. Awesome. Okay, now on her back. Now we'll check out the neck or the cervical spine. Okay, so we're going to get in here. We're going to see how Tara's neck is feeling today. And it is off. So I'm just going in and we're feeling the bones, right? I'm kind of pushing against them to see that restriction, see what's, for lack of a better phrase, what's poking back at me. That's how I know, right, that that bone needs to be moved. So with the neck adjustment, what we do is we'll set the head just on the side of the chiropractic table, okay? That's first things first. I want Tara in a nice rested position here, okay? I'm gonna rotate her head just slightly to the side. I'm gonna let her muscles relax and then a little push. Yep, at the top, awesome. And then we'll go all the way over to the opposite side, okay? Because she has one more on her left side that needs to go. So we'll bring the head up. Yep, we'll let that head rest. Again, we'll rotate the head. You can see my fingers, I'm contacting that bone and I'm kind of tugging at the muscle tissue, okay? And then just a little push right here. There we go, awesome, good. Perfect, perfect. So we adjusted Tara's neck, mid-back, and low back, right? Because those were the areas where she had those subluxations or restrictions, misalignments of the spine. Again, if you have any questions, please don't hesitate to reach out. Dr. Jacqueline Czajkowski at Minnesota Women's Care and WomanWoRX.